All right.
Uh-huh.
Our conversation right now is being recorded. I just wanted to let you know. So go ahead and ask that question again. So that way it's there. And I'm going to send you, I'll upload this to a private channel on YouTube, and I'll send you the link so that way you can watch it and be prepared. So the question about loaners again.
How to process the loaner's instrument.
Okay, so just like the list on the interview skills, you would still do the first section, making sure you have the tools to do the job: brushes, sponges, cleaning chemicals, personal protective equipment. You would go ahead and put on your personal protective equipment. You would skip the rest, and then at that point, since they're specifically asking about loaners, and you would talk about how to process loaners. And there's a process. First of all, you have to accept the loaners. So you have a delivery person who's bringing the loaner instrumentation in. You're going to check, you have to log it into a logbook, and the information is okay, what trays, what are the different names of the trays, what are the quantities, what surgeon is it for, which patient, and the date of the surgery. So that way you have the information, so that when it gets assembled on the preparation side, they know what information to put on the outside of the trays. Part of that checking in, oftentimes facilities have the equipment. You could take pictures of the loaner instrumentation to
Mhm.
verify that everything is there, that nothing is missing. If there's anything missing, you would document it. And then at that point, uh, you know, uh, you would also inspect for cleanliness and such. So you want to make sure, you want to notate the condition, and you also want to verify that they have an inventory sheet that was brought in with the loaner trays. At that point, you use the standard procedure where you would tray by tray, you would soak them in an enzymatic wash in the sink where they're soaking. All right, and then you would inspect, check to see if they have cannulas, make sure the cannulas are clean. Uh, Brushing, if you find any dirty cannulas, dirty instrumentation, you would have to go through the normal cleaning process of brushing underneath the surface of the water, and then putting everything back where it belongs. You would then sonic them, because typically loaner instrumentation are usually orthopedic instruments that have implants. So you also then want to put them through a sonic. Once that's done, you rinse them and then place them through the instrument washer. So that's it as far as the loaner instruments. Now, as far as on the preparation side, the staff would look, count, make sure which trays, make sure they have everything. They would inspect them to make sure that they're clean. They would also check the accuracy, making sure that, seeing if there's anything missing. If there is, they would definitely document it. And then they would move on, and they would put the chemical indicators in the appropriate spots. Usually you're wrapping, so it's going to be on each level of the container in the center. All right, so that way don't have any issues there. Then you would go ahead and wrap them, and that now the information that was gathered in the logbook, the doctor's name, the patient, the date of the procedure, you would log all that. I'll put all that on the outside of the wrapper, and then you would go ahead and sterilize them.
Okay, so when the instrument or the instrument comes on the clean side, what are some of the key areas that we're supposed to inspect, like cleanliness, uh,
Yes.
ratchets, the hinges, and the sharpness of the instruments?
Well, loaner instruments you won't typically have scissors or anything like that. But if there's hinges, yes, you would make sure that they're moving smoothly, and if need be, you would lubricate them. Absolutely.
So, um, just like instruments and not specifically on loaner's tray.
Okay.
So all the other stuff that I'm
Right. So specifically for instrument trays, first things first, you check for cleanliness. You always inspect for cleanliness. If any one instrument in the tray is still dirty, the entire tray is considered dirty and it goes back to decontamination. But once you inspect it and you see that it is clean, you're checking the functionality. Like I have a needle holder right here in my hand, and so I would operate it to make sure that it's moving smoothly. I would check the ratchet, the locking mechanism, and go like this. I would tap it to make sure that it doesn't unlock, because if I tap it lightly on the surface and it came unlocked, then it's misaligned. Scissors, I would test according to the manufacturer's instructions. So instruments are scissors that are longer than 4.5 inches. You use the red testing material. Scissors that are shorter than 4 inches, you use the yellow testing material. And you're just testing to make sure that it cuts through cleanly and that it doesn't snag into the material.
Okay.
And then you would lubricate as needed, assemble according to the count sheet. So the count sheet is an inventory sheet that goes through and tells you in order what's supposed to be on the tray and in what order it needs to be.
The count sheet, right?
Yes.
Okay, thank you. And in case like if I pick up a paper chart or a cart and it has several items missing, what would I do? What would be me as a tech in the department should do? Should I go look for those items?
Yeah, anything missing, they usually have an instrument board that where they have replacement instrumentation that you can gather. If you cannot find anything, you could always go to your lead technician, ask them. And if they can't find it, then what you would do is on the inventory sheet, you would indicate that it's missing and the quantity that's missing.
Okay. That's that was good. Good thing that so in case if I'm asked, since I don't have the hands-on training or haven't worked in the sterile department, what would be my answer? Like, how would I say to my hiring manager when they ask me, okay, what are some of the qualities I bring? I know I have customer service. I've been doing in housekeeping, so there is basically infection prevention, like controlling infection, disinfecting everything. Those are some of the things that I
Yeah,
have.
absolutely.
I,
All of your other past experiences, trust me, you have transferable skills.
okay.
Say, I'm very good at customer service. I listen intently to what it is that they need, and I make sure that I'm able to do it, or I go to the my lead for assistance. I will never just say, "Well, I don't know what to do," and just ignore it. I would get somebody's help if I needed help. But being that I've been a housekeeper, I've done high-level disinfection for room turnovers for patients and such, and I understand the necessity of making sure that everything is 100% clean, 100% sterile, 100% accurate 100% of the time. Because I view that everything I do, that potentially maybe one of my family members would be coming in and either an item is used on them or for this case, the room that they're going into, and so I'm wanting to make sure that they don't get an infection. I'm detail oriented. You can tell them I'm very detailed oriented. So once I am shown that to do it a certain way, that is how I'm going to do it until you come to me and tell me the standards have changed. Here's the documentation, the policy, and at that point I will make the change. So or if a manager comes to me and say, "Hey, we're going to be doing it this way," at that point I would make the change. And so, but I'm very detailed oriented. And so these are the things that you can have written down on a card and memorize them so that you're ready to answer. Say, great customer service skills. I'm detailed oriented. I have transferable skills. I understand the importance of what sterile processing does and how it works within patient safety and infection prevention.
So do I mention that I have the book knowledge too?
Oh, yes. You say, you know what? I went through school. I did extremely well. You got your certification?
Yes, but it's provisional one, and
That doesn't matter. Aleen, do you not understand how difficult that exam is? Did you find it difficult, or you're like, it was okay?
no, it wasn't. The chapter 2, which was like medical terminology, threw me off, and then I confused myself with chapter 9, which I believe was high level disinfection to
Right,
low level disinfection, and then yeah, it was disinfection, and then I threw myself up with the high level, high temperature sterilization and the low temperature. I just mixed the whole entire three topics so bad that it just confused me. So I had to put everything aside and just focus on chapter 9, understand it well. I actually did the chapter 9, I think 2 to 3 times, just to make sure it is disinfection and has different levels based on Spody
right,
classification. And then I had to like tell myself not to confuse and mix and match. This is
right,
low temperature sterilization and this is high temperature. And
right.
I
So
told
let me
myself
ask you this: when you took the when you took the certification exam, how long did it take you to do the test?
it took me a whole year to do it. Believe me, I signed up like,
No, 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 no. That's not what I'm asking. When you sat for the exam, they give you 3 hours.
oh, I was
How
done with
much time did you use? Two
uh,
hours,
yes.
which is about the average.
Mhm.
All right. And the fact that you passed it is outstanding. You have to understand, on average, only 55 to 65% of applicants ever pass the first time. Most other pass, the rest of them don't pass. They have to take it a second time. You did it on your first try, right?
Mhm.
Because you were in the part of the 95% from the school. See, our students have 95% of them pass the first time because, for whatever reason, the way you studied, you did outstanding. So yes, the book work. I went through school. I scored extremely high in my school. I was one of the top students. This is not. You got to tell them this is not a job. I don't consider this a job. This is a career. This is what I want to do
And
for
yes,
a living.
I want to build my career in that sterile department because
Yes.
came from the university from UC Davis to medical center at UC Med Center here in Sacramento. I was looking around because my director from campus told me, if you want to, you can transfer yourself and stay here. And I was like, I don't want to do housekeeping for the rest of my life. Let me look around and see what I can grow in. And something that really stood out and was exciting to me was the sterile department.
Right. So let me see here. I'm going to look at. Yeah, you have the. I'm telling you, you have what it is you need mentally. As far as and the passion, and that's great. And you want to get that across to them. But know that the stuff that you do does transfer over because you said you were in housekeeping.
Mhm.
Yeah, that now you may not necessarily know all your instrumentation, but you know the importance of making sure something is clean. All right, uh, so let's go on to another question. We had, do you have experience in processing hospital equipment? Yes, you do. As a housekeeper,
Yes, I do.
now they're not talking that when it's hospital equipment, it's not always the IV pumps, it's not all the sequential stocking devices, the feeding pumps. You wipe down IV poles, you wipe down the gurneys, you wipe down the beds, the tabletops. That's all hospital equipment.
The surgical lights, the ultrasound machines, the
Okay, so you've worked like in the OR, turning over the rooms in the OR.
yes, I have
That's
turnover.
even more important.
I have done turnovers in labor and delivery after the C-section. I have helped in turning over in the main OR when they were staff short.
Okay, so let me tell you the difference between an OR labor and delivery and cleaning a regular patient floor is different, because yes, you're doing a high level disinfection and all that, but in labor and delivery in the OR, you're doing what's called terminal cleaning.
Yeah, the terminal cleaning is different compared to turnovers. The turnovers, they OR assistants, they go in and turn over first, and then the EVS
Yeah.
housekeeper go in do the terminal.
So the answer to that
And
question, as far
oh,
as hospital equipment, yes, I've cleaned the equipment in the operating room in labor and delivery. It was my job to wipe them down using the appropriate germicidal, following the instructions for the length of time, for the exposure, the whole thing. So you could just say yes, I have experience. Now they're not going to. Chances are they won't necessarily ask, "Please describe what patient care equipment," because if they ask you, "Have you have experience in cleaning patient care equipment?" Say yes. You know, you got talk about the OR, talk about labor and delivery. Say we have the overhead light. We have, you know, they have the IV pumps that are inside the room. All right, that they keep in the room. We've got all the hold on a second. Why is that popping up? Okay. So you describe all the different pieces of equipment in the room for the OR and labor and delivery. If you do that and you start talking about the different equipment, they're not going to ask you, well, tell me what kind of equipment. And when you do, if they do, you go, well, I just told you we had the IV pumps, you know, we had, you know, the equipment that's
yeah,
in labor and delivery.
to
Because
us,
trust me, if you talk about it, the
and as,
equipment in this room, they won't ask that question.
mhm. Yeah,
You
so
know,
I still put it in there. The patient care equipments are the equipments that assist in the care and treatment of patients. They also provide diagnosis and monitor the patients.
right. Very good. Now, question number 4. When should you use gloves? Is it okay to wear gloves throughout the facility when doing rounds? You use gloves in order, the purpose of wearing gloves is observing standard precautions, treating everything as potentially infectious, whether or not the patient has been diagnosed with the disease or not. I don't know if this piece of equipment had been used on a patient or not. So when
Mhm.
handling it, of course, I would wear gloves. I would put it into the container, the cart for transport. But as I'm going through the facility, absolutely not. I have to remove the gloves before I leave the area. Otherwise, when I have my gloves, and let's say I'm touching the buttons, doorknobs, and buttons for the elevator, now I'm cross-contaminating things. So no, that's not acceptable.
Okay.
But anytime when do you wear gloves? Anytime I'm going to be doing cleaning, anytime that I'm going to be handling potentially soiled equipment. These are good questions, by the way. I'm going to steal these. I'm going to add these to the interview questions that I have.
Feel free, because seriously, I have been like stressing out, and then I sat down and I was like, I'm not going to stress out because I already have the knowledge. I have the book. I'm not gonna let this thing to throw me off and not be.
Aleen, let me ask you this. In housekeeping, you wear gloves, don't you?
We do.
And
We
when do you wear gloves?
when we go into a COVID room, we have our fluid
Well,
resistant.
any room. When you're going into a room to clean, you're going to put on, because you don't want to have the chemicals on your hands.
Mhm.
So, you know the answer.
Yeah, it's just I know my application, it already says routed for concentration, so I want to move one step ahead and
Right.
prepared. I don't want to, like, when they throw me questions, I'm like lost, because it has been like 15 to 18 years. I'm finally going for an interview and I don't.
Right. Oh, yeah. No, I understand. That's why I have this. That's why I meet with students one-on-one to do this. Question number 6. What is the contact time for cleaning equipment? Bottom line is, I don't know. I would have to read the instructions for use.
I can.
Each piece of equipment may be different. I have to follow the instructions for use for the equipment, as well as the instructions for use for the chemical that I'm using. So I would, when they say what is the contact time, I would have to refer to the instructions for use.
Refer to the instructions for use.
Yes, or the IFU.
Use. IFUs.
Yeah, you don't get bogged down and say, well, it's 3 minutes, it's 5 minutes. It says, you know what? I follow the IFU. So whatever the IFU tells me, that's what I do. You know, these are almost trick questions. You know, it's almost.
I was stuck at number 6. I was like, which kind of equipment? How long? What kind of chemicals?
Yeah.
And it seems like my question.
And remember, it doesn't matter what kind of equipment, it doesn't matter what kind of chemicals. You always go to the instructions for use first, and you read them, and to find out what the that's what will tell you the exposure time.
Okay.
Okay, number 7. Describe the central processing one-way flow.
From dirty to clean, inspection, decontamination to preparation and packaging, sterilization and sterile storage, and then distribution to wherever it is needed.
And then go and back to the decontamination.
And back to decontamination. Okay.
Yep. You got it. See, that's perfect.
Back to decon. Oh.
The purpose of one-way workflow?
It's to prevent the HAIs, the hospital healthcare acquired infections.
Yeah. It prevents cross-contamination.
Prevents cross contamination.
Yes.
Cross. Okay.
Number 9. Key areas. What key areas do you inspect? You inspect for cleanliness, functionality,
Or lubricate as it needs the hinges,
yep,
the plates, test material with yellow material and red depending on the sizes,
right,
and the ratchets.
right. See, that's all part of it, and that falls under the functionality part.
Mm-hmm.
So number 1, is it clean? Yes. Number 2, does it function? Is it working properly? Well, how do you know? You have to test it. You might have to lubricate it. You know, all the stuff that, and what testing material you use and stuff. You have that exactly right. Okay.
Mm-hmm. Oh God. You pick up a paper card and it's missing several items. What do you do?
Okay, so I'm assuming that this question is referring probably to a case cart. So in other words, it's talking about you have the inventory for possibly a case cart, for a procedure cart to go to the operating room or labor and delivery. So what do? You report it, number 1. Number 2, you would mark what items are missing. And you would communicate that to the rest of the team.
Items missing. Okay.
All right.
Uh-huh.
Number 11. You're doing rounds on the floor and you pick up equipment that is tagged MRSA. How do you handle it?
Do I handle that differently or like everything else?
No, you handle it the same way as everything else. Number 1, you're making sure you always, when you're handling equipment, remember, you follow standard precautions. And to me, this is how, standard precautions, the definition is, and let me look it up online just to
Precautions. Precautions.
Okay, so and hold on a second. Let me get the book.
Mhm. Standard precautions. Standard precautions. Method of using appropriate barriers to reduce the risk of transmission of bloodborne and other pathogens from both recognized and unrecognized source. It is the basic level of infection control to prevent transmission of infection organisms from contact with blood and all other body fluids to non-intact skin mucous membranes. This standard applies to all patients regardless of diagnosis or presumed infectious status.
Correct. So it's remember, and simply put, standard precautions is treating everything that it has been exposed to an infection, whether or not you understand that a patient has been diagnosed or not, doesn't matter. You just so my definition of standard precautions is whatever you're handling, pretend that it will kill you. So whatever you're most afraid of, if you're afraid of COVID, if you're afraid of AIDS, uh, Ebola, whatever it is that you're like, oh my goodness, that's the worst thing you could ever come in contact. You just pretend that treat everything as it has that, and that you use standard precautions. You wear the personal protective equipment that you need for that particular part of the job. If you're picking up rounds, all that standard precautions is gloves because you're not cleaning in that area. You're not creating aerosols. When you're in decon, use standard precautions by putting on the full PPEs. You transport in an enclosed container, in a cart, so as not to cross contaminate. So when they ask you, to me again, it's a trick question, because what I would do is say, well, tell you what if I had a piece of equipment that the patient had MRSA and they didn't tag it? How would I handle it? Would I handle it differently? No, I handle it the same. I'm put on my gloves. I make sure I don't cross contaminate everything. I put it in. I take my gloves off. I wash my hands. I make sure the cart's closed, and then I go on
Mhm.
and stuff. You treat everything the same. Now, when it comes to how you treat like surgical instruments in decontamination, well, I follow the IFU. How do I clean the equipment when it comes to into decontamination? I follow the IFU, and all IFUs follow standard precautions. Okay, so
Yeah.
that shouldn't be a problem. Number 12 says you're doing floor rounds and the nurse asks you to pick up equipment in the patient room. What do you do? Well, that depends on the policy of the hospital. Because some hospitals, if a nurse tells you it's okay to go into a room, it's okay. Other hospitals, it's not okay. So it all depends on the policy. I would have to defer back to my manager to find out what is the current policy of me being able to enter into a patient's room.
Okay.
Because let's say you go into a patient's room, patient's been discharged, the patient's gone. Of course you can go in the room. There's no reason for you not to be able to go in the room. You know what I'm saying? But if their patient is still there, you go like this. You just say, I follow the policy for the hospital. So, and then, what you do is then during the interview, what you do is when they ask you, let's say they say you're doing floor rounds, the nurse asks you to pick up equipment in patient room. What do you do? Say, well, I would follow the policy. So do me a favor. Can you explain the policy to me? What is how do you have your staff do it? Turn it around. Ask them a question. Put them on the spot, but do it nicely. There's nothing wrong with asking questions throughout the interview, because oftentimes, you want to turn it into a conversation.
Mm-hmm.
All right. You don't want them to ask a question, you answer, ask a question, you answer. If you ever come across a question, Aleen, that you don't know how to answer, just give it a moment, think, and say, you know what? Honestly, I don't know how to answer that question. So do me a favor. Please explain to me how you would want it done. And just turn it around on them and just say, how do you want it done? And, when you get them talking, and then you can ask them questions and stuff like that, it gets them off track. All right. And so.
So if I turn around and ask them, say, oh, okay, I don't know. I would rather ask my manager and see what they tell me, and then I'll follow their given instructions and then ask them, okay, what is the policy in the central processing unit department says so? Am I supposed to do it or not? Is that going to count like a negative point on me or not?
Well, again, that's why at the time when they say you're in the you're up on the floors doing rounds and the nurse asks you to do it, that's when you're clarifying and say, well, tell me what the policy is, because I'm going to follow the policy.
Mm-hmm.
So if your policy says no, that they have to bring it to the soiled utility room, then I'm going to ask him, I'm going to tell him, I'm sorry, but the policy is that I'm not allowed to go into patient rooms. You need to bring it to the soiled utility room, and I'll be happy to go ahead and take it down at that point. But you tell the manager, but if your policy is that it's okay for me to pick it up in the patient room, then I would tell the nurse, okay, thank you, what room number? And I would go in. So it all depends on the policy. What is your policy? You know what I'm saying? You give them both the scenarios and then you clarify, what is your policy? So that way I'll know what to do.
Okay.
That's how you answer. You can give both answers. One is, I'm sorry, I can't put it in the soil utility. The other one is, the policy states that I can, so I will do it. But tell me, please, what is the policy? How would you want me to respond to that situation? And then, well, we would rather them, okay, then that's what I'm going to do. That's how you do that. So
Okay.
this next one, how do you define teamwork, and what qualities would you bring if you join the team?
So
First of all, let me ask you, how do you define teamwork?
for me, it's like a group of people working together. One could communicate, everybody listens well. They could be a team leader who makes sure that everything is moving smoothly, and also we could complete all our tasks in a effective, according to the timely manner, and also make sure the quality is there. And in case of any changes comes in, to accept that changes with the, what do I say, enough positive attitude.
Fantastic.
And
And
then
then say, one of the qualities that I bring is
is
that
the,
I communicate effectively. If there's something that's unclear, I make sure I communicate that, and I ask questions. And um, there'd be times that maybe I can pick up some work that would help out the team. Some team members, they're like, those are my trays. I don't want you to touch them. Okay. But I see that they're missing some supplies like sterile indicators, things like that. So I can go to the storeroom. I can pick up some of the stuff, and I can help supply, restock the stations for them to be a good team member and stuff. So I'm willing to do whatever it takes to make sure that the workflow keeps going.
okay.
That's how I would answer that.
Okay.
You know, these
My
are good questions. These are really good questions. And you can also look for on the USB drive. There was the other document, sample interview questions that we wrote, that we sent out. Let me go. I'm going to bring this up real quick on the screen.
The other question to you is, in case of this interview kind of thing, are they going to ever ask us, okay, give me some of the equipments that goes in a regular minor tray or basic tray?
Uh, they may ask you, they might bring you a tray and they may ask you to identify them.
Oh.
What you do is you say, well, you know what? I appreciate you wanting to test me, but I haven't gotten that far. Know that I'm highly intelligent and I pick up things very quickly. And I look forward to being able to sit down and go through these trays. But at this time, I'm sorry, I'm not able to identify. I can tell you that those are needle holders, those are scissors, but as far as the specific names, I'm not there yet. But trust me, I learn very quickly. I mean, I see you have a count sheet right there.
Yes, I asked one of the supervisor to print it out and give it to me. So I have been trying to learn, but some of the words, like especially the names, I kind of had a little hard time, like Metzenbahn. So
Okay, now then the Metzenbaum, just to let you know, Metz.
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 Mhm.
Metz scissor. Most people don't even say Metzenbaum. They go Metz scissors, Irish scissors, Mayo scissors. There's the different needle holders. There's the Mayo Hager, the Dietrich. There's the uh, Prylewood. There's
Fakey forceps, Russian.
Bakey forceps, stuff like that. I
One,
doubt very seriously if they'll ask you that question.
hopefully.
Because what you're going to do is you're going to tell them that, um, I have a great concept of how everything works, the workflow and everything like that. And, so you just wait for that when that comes and when the time comes. If they ask you, well, can you name some of the instrumentation? Just tell them, say, you know what, I haven't gotten that far in my training, but I cherish the opportunity to be able to learn it because I'm going to learn it quickly.
Mm-hmm. So the screen that you're sharing, I don't have that on my flash drive. Tell
That's
me
weird.
about.
Okay, I will email it to you.
Okay, thank you.
But what it is this says question. Tell me about yourself. So they usually start off the interview by saying, "Can you share a little bit about yourself?" Now this is an opportunity for you to tell them about you and how you will fit into the department, your experience as a housekeeper in disinfection and stuff like that. This is not a time to tell your life story about, well, I come from this country, I have so many children, yeah, I've been married this long, I like to go karaoke. They don't care about that. That's not what the question is asking. The
Essentially,
question is asking, I'm a person, you know, uh, I'm really excited. I'm a type of person that I